Bismillahirrahmanirrahim. These are the few important questions regarding growth of the CVS or the heart. A road traffic accident causes a penetrating injury in the middle mediastinum where a muscular organ supplied by the coronary arteries is present. Which structure is most likely damaged? It is heart. It lies in the middle mediastinum and it receives the blood by the coronary arteries. Question number 2 is an infant continues to have interatrial shunting after birth because the foramen ovale fails to close. Which aortic septum is defective? Obviously, interatrial septum is defective because fossa ovalis lies in the interatrial septum, which is the adult remnant of the foramen ovale. Question number 3 is a patient presents with ischemia of the posterior left ventricular wall due to occlusion of the vessel running in the posterior interventricular groove. Which artery is most likely involved? Posterior interventricular artery is involved as it supplies the diaphragmatic posterior wall of the ventricles. Question number 4 is a surgeon incises the heart and identifies a layer containing fat and coronary vessels. Which layer it is? It is epicardium, which is also known as visual pericardium. Coronary arteries course within the subepicardial fat of the epicardium. Question number 5 is a knife wound damages the anterior interventricular groove of the heart. Which vessel is most likely injured? Left anterior descending artery or anterior interventricular artery? Left anterior descending artery lead artery lies in the anterior interventricular sulcus. Question number 6 is blood accumulates in the pericardial cavity leading to cardiac tamponade. It collects the blood between the visual and parietal pericardium. The serous pericardial cavity lies between the pericardial and visual pericardium. Question number 7 is following the pacemaker lead displacement, the patient develops arrhythmias. Which structure was disturbed? SA node is disturbed, obviously, because SA node is the primary pacemaker of the heart which controls the rhythm of the heart. Question number 8 is a trauma causes damage to the right border of the heart. Seen on the chest x-ray. Which chamber is most likely affected? Obviously right atrium because it forms the right border of the heart. Question number 9 is right coronary artery blockage mainly affects which chamber? Right atrium is affected. Right atrium primary supplies the right atrium, SA node and AV node. Question number 10 is a cyanotic child with the boot-shaped heart, harsh systolic murmur and squatting episodes. Likely congenital defect is tetralogy of Falley, and reasoning is boot-shaped heart appears due to the right ventricular hypertrophy. It is a hallmark of TOF, and the features of the TOF are pulmonary stenosis, pulmonary stenosis, right ventricular hypertrophy, overriding of aorta, and ventricular septal defect. Question number 11 is a tumor compress the vessel returning the blood from the head, neck and the upper limbs into the right atrium. Which vessel is damaged? Superior vena cava drains all the structure above the diaphragm except the lungs. Question number 12. A lesion affects the azygous vein. Which structure does it drain into? It drains into the superior vena cava. Azygous vein drains the thoracic wall. It empties into the superior vena cava. Question number 13 is a mass compress the vein draining the left posterior thoracic wall which crosses the midline at T8 to join azygos. Which vessel it is? It is the hemiazygous vein. It receives the blood from the left posterior intercostal vein, joins azygos at T8 level. The inferior diaphragmatic surface of the heart is mainly formed by which structure? Left ventricle that rests directly on the diaphragm, forming the most of its surface. Question number 15 is during aortic heart surgery, patient develops hoarseness due to the nerve injury. Which nerve was most likely damaged? Left recurrent laryngeal nerve. This nerve loops under the aortic arch injury. Vocal cord paralysis. This is a commonly asked viva question also. Question number 16 is sympathetic and parasympathetic innervation to the heart is by the cardiac plexus. Cardiac plexus, parasympathetic, vagus plus sympathetic fibers. Question number 17 is which external landmark separates atria from the ventricle? Coronary sulcus, AV groove. Coronary artery, coronary sulcus encircles the heart, separates atria and the ventricle. Question number 18 is a thrombus lodges at the right AV orifice. Which valve is obstructed? Tricuspid valve is obstructed because right AV orifice is guarded by the tricuspid valve. Apex beat is palpated at the fifth left intercostal space at the level of the midclavicular line. Left ventricle forms the apex which is palpable here. Question number 20 is a sharp object penetrates the sternocostal anterior surface of the heart. Which chamber is most likely damaged? Right ventricle, because it lies directly behind the sternum, most exposed anteriorly. Question number 21 is on routine exam, a patient's apex beat is felt in the fifth intercostal space just medial to the mid-clavicular line. Which cardiac chamber produces this surface impulse? Left ventricle. The left ventricle forms the cardiac apex and strike the chest wall at the fifth level left intercostal space, producing the palpable apex beat. Question number 22 is a patient with an aortic arch aneurysm develops hoarseness from the recurrent laryngeal nerve palsy. Which artery normally arises directly from the aortic arch? Left common carotid artery arises from here. It arises. Usual branches of the aortic arches are the left, from right to left, brachiocephalic trunk, left common carotid artery, left subclavian artery. So left subclavian artery, left common carotid artery arises directly. During the pre-operative planning for the CABG, the team identifies the artery that most influences the perfusion of both ventricles and the posterior interventricular septum. Which artery is this? Posterior interventricular artery, PDA, supplies the posterior septum and contributes to both ventricles. It is critical for posterior septal perfusion in right dominance heart, typically from right coronary artery. Question number 24. A patient with acute pericarditis complains of sharp shoulder pain. Refer to the left side. Which nerve is most likely responsible for this pain? Phrenic nerve is responsible because it supplies the fibrous and the parietal serous pericardium. Irritates irritation produces referred pain to the shoulder. C4 dominance. 25. A teenager with an anterior mediastinal mass thymoma develops facial plethora. Which of these veins running across the superior mediastinum anteriorly is most likely compressed? Left brachiocephalic vein. It courses horizontally across the anterior superior mediastinum and is commonly compressed by the anterior mediastinal masses. Question number 26. A patient is stabbed just above the clavicle. Which of the following listed structure normally traverses the thoracic inlet, superior thoracic aperture, and could be injured here? Subclavian arteries, because it passes from the neck into the thorax by the thoracic inlet. The zygous vein enters the thorax at a lower level near the T12 aortic hiatus. This can be asked to you vice versa. Question number 28 is an elderly patient ECG and conduction study indicate block of the AV bundle. Which artery most commonly supplies the AV bundle and thus is likely implicated? Posterior interventricular artery. In most right dominant hearts, the posterior interventricular artery PDA from the right coronary artery supplies the AV node and AV bundle region. A stab wound to the left anterior chest lacerates the anterior interventricular branch of the left coronary artery, which vein commonly runs in the same groove and is therefore likely injured too. Great cardiac vein. Great cardiac vein ascends in the anterior interventricular groove alongside the LAD, left anterior descending artery. A patient is stabbed in the right first intercostal space just lateral to the manubrium and above the sternal angle. Which vessel in that region is most likely at risk? Right subclavian artery, as it arches laterally and superiorly across the root of the neck near the first rib and clavicle region. It is the structure most anatomically related to the first intercostal or manubral border laterally. 31. Angiography shows occlusion of a vessel running down the anterior interventricular groove to the apex. Which cardiac region is most commonly infarcted? Left ventricle. The LAD supplies the anterior wall and apex of the left ventricle and much of the interventricular septum. So, LAD occlusion primarily affects the left ventricle. A patient with tricuspid regurgitation has cusps that do not remain opposed during systole. Damage to which structure most likely causes this? Chorda tendineae, because chorda tendineae anchor the valve leaflets to papillary muscles and prevent leaflet prolapse. Rupture or dysfunction leads to regurgitation. During CABG, the surgeon slips a finger behind the great arteries and in front of the venous structure to pass a clamp around the outflow trunks. Into which pericardial space is the surgeon's finger most likely inserted? Transverse pericardial sinus. The transverse pericardial sinus is the surgical space posterior to the ascending aorta, pulmonary trunk, and anterior to the superior vena cava, left atrium, commonly used to isolate the outflow vessels. Question number 34 is a 62-year-old year old has a tumor compressing the vessel that drains the right posterior thoracic wall before arching over the root of the lung to enter the superior vena cava. The azygous vein drains the right posterior intercostal vein and arches over the right lung root into the superior vena cava. 35 is a stab wound injures the vein, draining the left inferior thoracic wall into the azygous vein, which vein is likely damaged. Hemiazygous vein drains lower left posterior intercostal vein, crosses to join azygos. A patient with severe chest trauma has bleeding from a vein that drains upper left thoracic wall into the azygous system. Which vein is involved? Accessory hemiazygous vein is involved because it drains the upper left posterior intercostal spaces join the azygos. 37. A 58-year-old male undergoing CABG has a blockage in the artery that supplies most of the diaphragmatic inferior surface of the heart, which artery? Obviously posterior interventricular artery, which we have already discussed, that supplies the both ventricles and inferior septum. 38. A patient presents with ischemia of the right border of the heart. Which artery is most likely stenosed? Right marginal artery branch of the right coronary artery supplies the right ventricle and acute margin. During valve replacement surgery, the surgeon notes a damage to the parasympathetic supply of the heart might occur. Which nerve carries these fibers? Vagus nerve. A vagus nerve provides parasympathetic fibers, decrease heart rate, decrease conduction of the heart. 40. A 72-year-old man has arrhythmia due to damage of the sympathetic innervation of the heart, which structure is damaged. Cardiac plexus that contains sympathetic fibers, increased heart rate and contractility. Aortic dissection affects a branch directly from the ascending aorta. Which artery is most likely damaged? Only the coronary arteries are most likely to get damaged. 42 is a penetrating injury damages the main venous drainage of the myocardium located in the posterior coronary sulcus. Which vein is most likely damaged? Coronary sinus is the primary venous drainage that is posterior AV groove. A patient has a patient has enlargement of the left atrium compressing a structure carried oxygenated blood to systemic circulation, which structure is compressed. Ascending aorta is compressed. Ascending aorta is anterior to the left atrium. Enlarged left atrium can compress it. Trauma to posterior mediastinum injured the vessel receiving the blood from the bronchial, esophageal, and posterior intercostal veins on the right. Which vein? The azygous vein collects the drainage from the posterior thorax and the esophagus. During the cardiac surgery, the surgeon clamps a large artery in the coronary sulcus between the right atrium and right ventricle. Which vessel is most likely damaged? Right coronary artery runs in the right AV groove. Hypertrophy of the right ventricle compresses the nerve supplying the parietal pericardium that refers the shoulder pain. Which nerve is most likely damaged? Phrenic nerve. That is a very commonly asked question.